So in terms of my time in private practice, we were starting to come out of those ages of disorganisation that I've alluded to, and professional ineptness, if I can use that word. We were still handmaidens to the doctors, to the medical profession. We had an ethic that said we would not treat a patient without a referral from a doctor, and most of the doctors had prescriptive referrals, and if they prescribed shortwave diathermy and ultrasound, then that is what you did. You did not question it. You had that as a requirement. And if they said 3 treatments, you did 3 treatments, and then you got back to them. Very restrictive, very prescriptive. And of course, you were not allowed to be out there. And our ethics dictated that you were in private practice not allowed to have a plaque more than, I think it was something like 10 inches by 8 inches, and the lettering on it was not to be more than, say, an inch high, whatever the details at the time were. In other words, a far cry from the glowing neon lights and huge signs and so forth that we have today. There was no way that you were allowed to advertise yourself other than by this. You weren't allowed to advertise in the papers or whatever. It was considered to be very unprofessional. And indeed, it reminds me, going back actually to my time at the physio school in my final year of just backtracking to my final year of training, that I wanted to go to Melbourne on a rowing regatta in some crummy four that I was rowing in just for the hell of it at the time. And I went to the head of the school asking him to sign a student declaration to get a cheaper airfare across, a student airfare. And he referred me back to Mr. Dawkins, the chairman of the board, who rang me and said, blah, blah, I understand you want to take time off work, Mr. Drok, off study. I said, well, it's only for a couple of days. He said, oh, well, just make sure you pass. There will be no letting you through or anything like that if it's a bit squeaky. And I said, yes, Mr. Dawkins. So I went back to the head of the school, Cliff White it was, had taken over at that stage. And he very reluctantly signed the document, and he said, well, what if you have publicity? What if you're mentioned in the papers or you even have a photo taken? And I said, Mr. White, surely that's our job. We want to promote physical fitness and health and activity and movement and physiotherapy and get out there. He said, oh, no, Mr. Drok, no, we don't want any publicity like that. This was the attitude of the day, and hence coming back to the ethics of the society in 1975 that required us not to have more than this little brass plaque on your door. So we sort of went with that, and we pushed the issues there, and just following on through the clinical side of private practice, I'd had the impression from my training days that were only a few years earlier, that once one qualified as a physiotherapist, that was it. You didn't ever go back to physio school, you didn't ever do any other training, there was nothing else. At that stage, one of the guys in Perth had gone to Adelaide and done a little bit of a course with Maitland and come back again, and we all thought, wow, he's actually gone off and done something after physiotherapy school. And of course, this concept was still in your brain that was the end, that was the pinnacle of your academic existence, and from then on you just got on with your life and got on with working. Of course, things started changing then. We had Maitland, and then we got the Carlton-born coming through, and the Scandinavian school of people, and the various organisations, private practitioners and the manip therapists who were just starting up in those days, started bringing in people like Syriacs. He actually came out here on a weekend, and I remember Herr Professor Doctor from Scandinavia, oh Lord, his name escapes me, it'll come to me soon. So these international figures were starting to come and do seminars and do courses, and of course the Manip Therapy group was starting to organise their manipulation and manual therapy course based on so many weekends and then eventually their assignments, and it became a bit of a blueprint for the various special interest groups to follow their course structures to the situation now that, of course, we have a wonderfully integrated course structure and postgraduate ongoing education situation, which did not exist in those days. So we obviously needed to upskill, upgrade. We did Manip courses and the follow-ups and the refreshers, and we changed tack occasionally. We brought in other things like the acupuncture and the sports medicine, and there you are sort of 20, 30 years later, and forget the idea that you're never ever going to go and sit in the classroom or do any learning again. You're just constantly learning, to now, of course, the full requirement of HPCA is that you have to keep learning. There's no question about that. It's there. So that was how the professional requirement changed from those early days to she'll be right, and if you didn't do it well, who cared? That was the way you did it. And unfortunately, and I could point a few fingers of the quality of physiotherapy work in those days was actually reflected by this approach to requirement in terms of ongoing education. To the degree that as life went on and my involvement in the profession got deeper, it became obvious that all these different groups, the Manip therapists, the occupational health, the acupuncturists, the whole list of special interest groups, were all off doing their thing, but there needed to be some sort of cohesion there in the end to make it really work, which is where the concept of the college really started coming together. And in those years, there were some of us, Margot Skinner was one, Mike Lamont was another, who could see the requirement for this idea of the College of Physiotherapy. And of course, in those days, there was no consideration of requirement from government or from registration requirements. It just was a logical step